Hi, my name is Dr. David Tenner of the Goldberg Clinic for Chronic Disease Reversal located in Atlanta, Georgia. Today I'd like to present an interview with a patient that we've been working with for the past 2 years. The patient came to see us with a medical diagnosis of rheumatoid arthritis. The patient had been on numerous medications, including steroids, methotrexate, and other immunosuppressant agents, but failed to improve while under medical care. At her initial visit, we performed a comprehensive case history, physical exam, and laboratory testing as needed. Following her initial visit, we developed an individualized program for her to follow that addressed the causes of her health problems and created the best conditions under which the patient could evolve back into a state of health. The following interview is a detailed account of the patient's experience with us at the clinic and the significant improvements that she has seen while under our care.
Hello, this is Dr. Paul Goldberg of the Goldberg Clinic in Kennesaw, Georgia, and I'm here today with Miss Emma Hall, who has been a patient of ours. When did we first see you, Emma? Back in the end of 2010. And Miss Hall has been very successful in getting well from some serious health problems, and she has been an excellent patient, and we're here today to learn about her story. Emma, when you first came into the Goldberg Clinic, what were you dealing from?
They diagnosed me with rheumatoid arthritis, and at that time, severe pain. I was having severe pain in all my joints.
I remember when you first came in, what was your condition? You had been medically diagnosed with rheumatoid arthritis, and what was your condition when you first came to our clinic?
It was sad. I was getting where I could hardly get up and down, couldn't sleep well at night, I was just there. The doctors had told me that they were doing good to keep me out of a wheelchair.
The medical doctors, rheumatologists said they were doing good just to keep you out of a wheelchair. And I remember you kind of hobbled in here, and you needed some support from other people. I remember, who came with you the first time?
My sister and my niece.
Your sister and your niece came with you the first time. And what were they doing for you with this condition, what they're calling rheumatoid arthritis?
Well, they had put me on methotrexate, and I had such a reaction from that. That's a real hard drug to take. I had taken that once a week. They put me on that. My skin turned into reptile skin. They took me off of that immediately. They said that that wasn't going to work for me, so they started just giving me every 4 days. They would say... So you were having a number of side effects from the drugs they were giving you? Oh, yeah. And they would say, come in every 4 days, and they would give me IVs with steroids and Nubain. Which is a painkiller, actually a type of narcotic. And the steroid would give me what I could go like the next day. And then every 4 hours I was to take Percocet and Soma. That was a new pain medicine they'd give me. They give me the Flector patches for during the day and a different 8-hour patch, like a morphine patch for night. And a morphine patch for night. So you were on narcotics, you were on steroids, you were on immunosuppressant drugs. They were just loading you up, weren't they? Yeah. And were you getting any healthier from all that? No, no. My skin started turning gray, and I was noticing my eyes were getting yellow looking, and my skin was gray and yellowish tint. And that wasn't the worst part, though. The pain is what got me trying to find out something different. When I went online and I researched your clinic, but the pain was just terrible. How was your life overall? How would you rate the quality of your life at that time with all those drugs you were taking that were all medically prescribed for you? Well, I got to the point where, honestly, my quality of life, I didn't even care to live. I really, my daughter would have to come down in the mornings and help me get my hair fixed, put on makeup. I couldn't even, I could do nothing. I was really just existing. I was existing. Okay, and when you came down here, we assessed you, we did some metabolic testing on you, we did a physical exam on you and a case history, and then we started you on an individualized program. How long after we got you started did you start feeling better? About 30 days, wasn't it? About 30 days later.
It was actually about the third day.
Yeah, but
that's Mr. Jimmy Hall of Hall Heating, Air Conditioning, and Electrical. Right. Her husband, Ms. Hall's husband. Yeah, it was about 30 days later. And how long had you actually been sick?
7 years.
7 years. So in 30 days you began to feel better. And what progressed after that, after 30 days? Did you have ups and downs along the way at all?
And the little while I did, I started because I don't know, my body, I guess I had been so used to hurting that it was a mental thing also, but for the first little while I had some ups and downs. Then when I was doing what you told me to do, and when I stayed strict on everything we had went over, I noticed everything started getting better.
And what we had done a biochemical analysis of Miss Hall. We understood what was going on with her individually in terms of her biochemistry. So we set her up on a plan to alter that biochemistry to normalize function. Again, as we always do here, we're trying to normalize function. We weren't trying, did I tell you I was going to treat your rheumatoid arthritis? No, we don't treat any disease. We are, in fact, at our clinic, we are opposed to the idea of treating disease. We want to normalize function. If people function normally, then they will be healthy. It's just that simple. If they're functioning normally, then whatever aches and pains and problems they're having will go away, and they're going to be a healthier and a happier person. What's your overall, this is now, we're looking at over a year later, and has your health continued to be well?
Oh God, yeah. Now when we have a change in the weather, I may have to take an aspirin. That's it.
So from methotrexate and prednisone and narcotics and IVs, now on occasion if the weather changes, you might take an aspirin.
Mm-hmm.
Do you feel like you're in better control of your health now?
Definitely.
Okay. What does Mr. Hall think of all this?
I think it's great because we get to do things during the summer and all that we couldn't do before.
You couldn't do that before.
Couldn't even get out and about.
What do you think would have happened, Imogene, if you had stayed on all those drugs? What do you think the long-term repercussions would have been?
I really think it would have killed me. My liver and everything. I really think when my body was spilling, I really think it would have killed me. But and I know my doctor would tell me, well, honey, all I'm trying to do is just keep you out of a wheelchair. My rheumatologist would tell me that. My medical doctors and specialists they sent me to, we'll try to keep you out of a wheelchair is what we're really struggling to do here. And I really think by now I would have probably been dead, really.
And the notable thing is there's nothing they were doing with Miss Hall that they don't do with other people. That the type of care that she was receiving for rheumatoid arthritis is very similar to what we hear day after day, year after year in our clinic. Immunosuppressants, steroids, painkillers, and a gradual decline in health rather than identification of what's causing the problem, addressing it, and then watching a patient evolve into better health. All right, well, we know right now that you have a very optimistic mindset, you have a good future ahead of you, and you're seeing me less and less, and you've made, once again, health care has become self-care. Thank you, Ms. Hall. Anything else you want to add?
Thank you.
You're welcome. My pleasure.